बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम फ्रेंड्स, उम्मीद करते हैं कि आप सब खैरियत से होंगे। फ्रेंड्स, आज के सेशन में हम डिस्कस करेंगे व्हेन योर स्किन टेस्ट इज़ पॉजिटिव। वीडियो की तरफ बढ़ने से पहले हमारी आपसे रिक्वेस्ट है कि हमारे चैनल को सब्सक्राइब कर दें। चलें फ्रेंड्स, बढ़ते हैं आज के सेशन की तरफ। पॉजिटिव स्किन टेस्ट, this means that the person's body was infected with TB bacteria. Additional tests are needed to determine if the person has latent TB infection or TB disease. Negative skin test, this means the person's body didn't react to the test and that latent TB infection or TB disease is not likely. There is no problem in repeating a TB skin test. If repeated, the additional test should be placed in a different location on the body. For example, other arm. The TB test is the preferred TB test for the children under the age of 5. Now, we will discuss here the testing for TB infection. Updated August 30, 2022. The COVID-19 vaccine should be delayed because of the testing for TB infection. TB test, the skin test and TB blood tests are not expected to affect the safety or effectiveness of the COVID-19 vaccine. There are two types of the test for TB infections, the TB skin test and the TB blood test. The person's healthcare provider should choose with the TB test to use. Factors in selecting which test to use include the reasons for testing, test availability, the cost. Generally, it is not recommended to test a person with both a TB skin test and a TB blood test. The TB skin test is also called as the Mantoux tuberculin test (TST), and a TB skin test requires two visits with a healthcare provider. On the first visit, the test is placed. On the second visit, the healthcare provider reads the test. The TB skin test is performed by injecting a small amount of the fluid called the tuberculin into the skin of the lower part of the arm. A person given the tuberculin skin test must return within 40 hours to 72 hours to have a trained healthcare worker looks for a reaction on the arm. The result depends on the size of the wrist and hard area or swelling. Here we will discuss how can I tell if I have latent TB infection. A TB skin test, Mantoux, can show if you have latent TB infection. You could have latent TB infection if you have ever spent time close to someone with active TB disease. Even if you didn't know they were sick, your healthcare provider will use a small needle to inject some harmless testing fluid called as tuberculin under the skin on your arm. Your healthcare provider must check your arm 2 or 3 days after the TB skin test, even if your arm looks okay to you. If you have a reaction to the test, it will look like a rest bump. Your healthcare provider will measure the size of the reaction. If there is a bump, it will go away in a few weeks. How do I take care on my arm after the TB skin test? Don't cover the spot with the bandage or tape. Be careful not to rub on it or scratch it. If the spot itches, put a cold cloth on it. If you wash your arm and dry it gently, don't be afraid to be tested. TB can be cured. What if my TB skin test is negative? If the test is negative, if there is no bump or only a very small bump at the spot where the fluid was injected, a negative TB skin test usually means what you don't have TB. In some situations, you may need to have other TB skin test letters. What if my TB skin test is positive? The test is positive if there was a bump of a certain size where the fluid was injected. This means you probably have the TB germs in your body. Most people with a positive TB skin test have latent TB infection. To be sure, your doctor will examine you and give you a chest X-ray. You may need another test to see if you have active TB disease. You should have a skin TB test if you have had frequent close contact with someone who has active TB disease, and you have lived with a community where many people have TB. You work or live in a nursing home, clinic, hospital, prison, or homeless shelter, or you have HIV infection or certain other healthcare problems. What if I have had BCG vaccine? Even if you have had a BCG vaccine, you can have a TB skin test. People who have had BCG vaccine still can get latent TB infection and active TB disease. BCG vaccine may help protect your young children from getting very sick with TB. This protection goes away as people get older. BCG vaccine sometimes cause a positive TB skin test reaction, but if you have positive reaction to the TB skin test, it probably is from TB germs in your body, not from your BCG vaccine. So friends, this was all about our today's session. होप सो आपके लिए बेनिफिशियल साबित हुआ होगा। मिलते हैं नेक्स्ट वीडियो में, तब तक के लिए अपना ख्याल रखिएगा। हमें दीजिए इजाज़त। अल्लाह हाफिज़।